Good morning, it's Dr. Rapiti. Welcome to another video. It's Saturday the 14th of May 2022, and today I want to talk to you about what I'm seeing in my practice from the cold face. I definitely think there is a new strain, a new variant of the Omicron or whatever version there is, and why I say this is that the presentation is pretty unique and different from all the previous strains. Firstly, let me assure you that yes, there is an uptake of the number of people getting the flu or symptoms like the flu. That shouldn't be any cause for alarm, though the government would like you to believe that there's now a new wave coming on. We should all hide into our bunkers and disappear with masks and isolation. I think that's the most ludicrous policy that was ever introduced. It really was of no benefit. I think there's umpteen studies to show that lockdowns, isolation and quarantine just don't work. I think what we're witnessing in China is atrocious, where the city of China with 25 million people have been in lockdown for 28 days and they've achieved nothing because you cannot stop the Omicron virus. I'm not going to spend too much time on the Shanghai situation. I think it's totally against human rights, but what does China really know about human rights? But I'm seeing in my practice now is that patients are coming in with symptoms of the flu. I think we need to understand that the COVID virus is now different from a flu virus. The symptoms are very much, cough, fever, sore throat, joint pains, body pains, and that's very typical of a flu. So we're never ever going to get rid of the COVID strain or the COVID variants. I think it's like saying you're going to isolate people to get rid of the flu. We never got rid of the flu. We never will, because that's the nature of these pathogens. They multiply or mutate and resurface as something different all the time. So, sorry about that. It's my morning clearing my throat. But what I was going to say is that when Fauci came up with these stupid policies of boosters of trying to contain the virus and getting rid of it, I think he needed his head read, and so are the many people who are proposing such a policy. So what is happening is that I'm seeing patients who come to me and they would have a normal oxygen level of 99%, and they would admit on asking them if they noticed that they were getting a little tired or short of breath. Not running out of breath, there's a difference. Feeling a little tired doing ordinary chores or ordinary activities like going to the bathroom, changing, taking a shower, it's a bit of an effort. And that is my classical sign. And I've noticed I've had 3 patients who presented to me in this week with pneumonias, and all of them had the flu one day before. One day before that, they noticed symptoms. They came to me the next day, and I checked them out. They had oxygen levels of 99 or 98%. But their peak flow, which was a very good indicator of some lung pathology, especially if they're not asthmatics, was in the region of 100 to 200. Bear in mind that the normal peak flow, where you blow through a peak flow meter, is about 400. And that tells us that there is a problem in the lungs. And so based on that, with a history of declining effort tolerance, if you suddenly find after you get the flu that you're getting somewhat tired doing simple things like dressing up, then I think doctors should be on the alert and use that sign, because waiting for conventional signs. What are the conventional signs? We wait for oxygen levels to drop down to about 90. We look for crepitations in the lungs. There is some sign that something is happening in the lungs. Or we send patients for an X-ray. That is way too long. That would take about a week before you can catch the disease. My way of dealing with this is to take a good history and just those 2 signs. Are you feeling tired doing simple things after you've got the flu? And remember, there's a difference in getting tired from your body being weak and you being slightly out of breath. If they answer to that and they have a low peak flow, then that to me says they're now heading for a pneumonia. And traditionally we've been told in the last 2 years, wait 8 days. And I told you last year during the Delta strain, within about 3-4 days. What I'm now seeing within the first day, and what I fear is that if we don't act fast enough and treat quick enough, what's going to happen? A lot of people are going to wait and protract this illness, and by 4 or 5 days they're going to get whopping pneumonias. They're going to end up in hospitals, and that's going to give Dr. Joe Pashler ammunition to say, oh, well, we've got a terrible wave, lots of people in our hospitals because they're not being vaccinated. And that's not true, because the incidence is not the issue, it's the complications. And even there too, if we know how to preempt the complications, treat early, we can prevent a kind of situation where people are flooding hospitals. There's no need for anybody with COVID to land up in hospital, even if you have a low oxygen level. With a proper protocol, with repurposed drugs, we can save the situation. As for the vaccines, I'm pleased to share with you that Denmark has decided to drop all vaccine rollouts because they felt it was useless, and of course we all know that, because the Omicron strain spread so rapidly you cannot contain it, and it as actually the Omicron is totally resistant to the vaccine. I need to repeat that. This Omicron strain is totally resistant to the vaccine. So I cannot find any logical or legitimate reason to make vaccines mandatory. If we had a fair judge, I think that would be thrown out of court, because you do not use a vaccine that doesn't work and that has side effects. I think it's as simple as that. We're going into a lot of arguments about it. And in the end of the day, what the rest of the world has now agreed, even Dr. Fauci of all people is now accepting that people have got herd immunity. He doesn't mention how they've got it. Over 57% of Americans have been naturally infected, which means if you have 70% of the people vaccinated and 57 to 60% with natural immunity, what it means is that people that have been vaccinated have also been infected. It proves that the vaccine doesn't protect you. Another study came out showing that as you have progressively, it's Walgreen who does a lot of these studies, and their studies show that people who have the third boost had the highest number of reinfections, meaning that the vaccine didn't work. And now I want to talk about something that's been hitting the headlines, and that is Canada's euthanasia policy. It is so atrocious. In 2016, the Trudeau government has been encouraging and supporting people who have serious illnesses that they cannot live with euthanasia, or people with serious illnesses and cannot find suitable housing to agree to euthanasia. And I think this is such an atrocious system. It needs to be condemned, and this is typical of what we expect in the World Health Order. And they're even going to go so far as those people too poor to survive and cannot live in this world and wish assisted euthanasia, the government will do so. I think it's such an amoral thing. I don't think we can support it. We cannot sit by and accept this rubbish to go on. Yeah, and I think that about wraps it up for today. I would think we should just be careful that what China is doing in Shanghai is atrocious. If one person in a building was tested positive, they would shut the entire building. People are being starved. And we're going so much about this COVID. I don't think how many people realize that many people, we have something like 300 million people starving in the country, in the world at the moment. Far more people dying of starvation than through COVID. I think the policy that's been introduced by Joe Pashler, our Minister of Health, is totally hideous. It should be abandoned, and he's up for a challenge when he thinks he can get away with it. All we need is citizens that are woke, will start doing something and stop taking everything that the government gives us. And as for the big corporates, they too should be sent in for a good drubbing legally for forcing their staff to take the vaccine. Thank you very much. Take care, and God bless Dr. Rapiti.